I think that there's absolutely a link between posture and chronic pain, posture and organ dysfunction. People that have, say, a scoliosis, that have abnormal frontal view curve of the spine, that can interfere with breathing and cardiac output. It's already been established in the
Mm.
scientific literature.
Welcome to Beyond the Pain, the podcast that explores what it really takes to break free from chronic pain and reclaim your life. I'm your host, Leigh Brandon, and someone who's spent over 2 decades helping people get to the root cause of pain that no one else could explain. Whether you're dealing with long-term back issues, joint pain, nerve discomfort, or mysterious symptoms that just won't go away, this show is here to help you go deeper. Because beyond the pain, there's clarity, strength, and power waiting for you. Each week, we'll uncover the physical, emotional, biochemical, and energetic causes of pain and how to transform them. Let's dive deep into this week's episode. Chronic pain is rarely as simple as it seems. While many people focus only on where the pain is felt, the real drivers can often lie much deeper in posture, movement patterns, old injuries, degeneration, muscle imbalance, and even nutrition. In this episode, Dr. Kevin Smith shares how his work evolved from traditional chiropractic care into a more holistic approach that also includes clinical nutrition. We explore how chiropractic and nutrition can work together to uncover the root causes of chronic pain, why some people stay stuck in pain long after the injury has healed, and why education is such an important part of the healing process. This is a valuable conversation for anyone who wants to better understand what may really be driving chronic pain and what it can take to create lasting change. Kevin Smith, welcome to Beyond the Pain. It's great to have you on the show.
Thank you for having me. It's an honor. It's an honor to be here today.
The honor is all mine, Kevin. So, Kevin, I'd love to start with your story, your journey. So if you could maybe share, how did you end up, doing what you do today? How did you manage to get where you are? What's your journey been?
So I've been in practice for 25 years, and I went to the
You don't look old enough, Kevin.
well, my wife might disagree with you. I've been in practice for 25 years, and I'm a doctor of chiropractic, and I'm also a clinical nutritionist. And I graduated from the Palmer College of Chiropractic in Davenport, Iowa, in 2001. And so I started my pre-med journey in around 1994, and then I got accepted at Palmer, and I went there. I had to relocate my family. At the time, it was me, my wife, and my dog. And when we left Iowa, it was me, my wife, my dog, and a daughter. So somewhere along the way, we had a child. And then I moved back to Pittsburgh, and I immediately went into practice for myself. And I was treating the types of things that most people associate with chiropractic care, such as back pain, neck pain, knee pain, shoulder problems, sports injuries, automobile accident injuries, things like that. And somewhere along the way, people would come in occasionally with some weird, mysterious problem that I had no idea how to fix that. And it caused me to become curious, and I started to attend seminars and read books and things like that. And then that led me into the world of nutrition. And so right now it's like a 50-50 mix of chiropractic and clinical nutrition. So I can reach into both worlds. So if somebody comes in with back pain or neck pain or headaches or something like that, I can go to the chiropractic thing. And then if they have a problem involving um, high blood pressure, for example, or hypothyroidism or autoimmunity. I can help them with that. And my journey has been a kind of a mix. So um, I guess I'm double board certified for that.
Mm. Okay, so it's been around a 25 year journey for you?
Yeah, about that, yeah, yeah.
Yeah. And when did you start practicing nutrition?
Around 2003.
Okay.
So, um, it it's a very, very different type of thing than chiropractic. Clinical nutrition is more about, I guess it's more subtractive than additive. It's about taking away things. So, for example, if people eat at McDonald's 6 days a week, they're gonna eventually develop a chronic pain problem or a chronic issue, whether it's high cholesterol, high blood pressure, obesity, or something. So my goal is to try to teach people how to eat clean and how to use various supplements to balance the equation out. And, there's a lot to it. Do you ever walk into like a nutrition store and see this bewildering array of supplements on the wall and you have no idea really what to do? And the pimple faced kid sitting behind the counter knows about this much more than you do. Um, you really need somebody to get to guide you, and that's comes down to me. And
Mm,
so I help people with their diet and with their nutrition, and we order lab testing, blood, urine, stool, saliva to find out what's going on. But then that's, I get, again, that's about 50% of my practice. The other 50% is chiropractic care, of which I've been doing that for about 25 years, and I do a lot of unconventional therapies and type of modalities with people.
mm. So what led you to chiropractic?
I got a job working for a chiropractor in a little town called Monroeville, PA. It was kind of near my home at the time, and he really inspired me. I had thought about going into something in physical medicine, whether physical therapy or whatever. So I tried the physical therapy thing. I got a job working in about three different physical therapy centers. And then I got a job working for this chiropractor, and all of a sudden it just made sense that it was a better fit. And I really, really gravitated towards that. And I went for it and I never looked back.
Mm. Yeah, it's interesting because I often ask that question to guests on the show, and I also see it in lots of my colleagues as well. But quite often, people get into these fields because they've had their own issues, and then they went and found someone like a chiropractor who helped them, and they get so inspired they think, "Well, I can help other people do that." But it's interesting that that wasn't your route.
Well, it was in a way. I did go to chiropractors throughout my life, starting when I was around 18 years old. I went to a chiropractor after hurting myself on the job, and he really helped me a lot. I've been to three or four chiropractors, and I really liked what they did. And I think that played a role in my decision making process along the way. It wasn't like a conscientious life altering thing. I just kind of fell into it.
Mm. Yeah, yeah, I can see that. And again, I think even for people that have been through that themselves in terms of, yeah, they had this issue, went to see someone, wasn't necessarily something they thought, yeah, I'm really going to do this. It was just, they just felt compelled, it's like, wow, I can really help people by sharing what I've learned by going through my own process. But it's interesting. I kind of started in this industry and then had issues, which was I was going along, but then my training helped me to overcome them.
Mhm.
And then also helped me be able to empathize so much better with people that were going through the same pain conditions that I and other conditions as well that I'd suffered from.
Well, throughout my life, I've had back issues and neck issues, and so I can empathize with people from that side of things.
Mm.
What what I try to do is I try to get people to own their condition by educating them about what's going on and why they have pain and what we can do to try to help them. I think that that is in my country, at least, it's when they go to the medical doctor, they get very little information. On average, they spend about 7 minutes of face-to-face time,
Mm,
and then they write them a prescription, and that's it. So every time they take the pill, whether it's a muscle relaxer or it's an anti-inflammatory agent or something like that, they are getting a therapy. It it's a Band-Aid, it's not really corrective,
mm,
and, sometimes people they are looking for things to fix a problem rather than just gloss over it and with superficial, treatments. They're looking to
mm.
dig in a little bit more, and that's where I come in.
Yeah, absolutely. So obviously you've got this, quarter of a century of experience. Sure, you've seen lots of many pain conditions over the years, but what do you believe are the most common root causes of chronic pain?
Well, when you phrase it like that, I really feel old. A quarter of a century. I think that there's acute pain and then there's chronic pain, and I'm a chronic pain specialist. So, uh, let me differentiate the 2. Acute pain is when you have a new injury or something like you're riding your bicycle and you fall off and you hurt your knee or you hurt your hand or your shoulder. That's a new injury, that's acute. When it comes to chronic pain, that would be something like arthritis, something that's been degenerating for a long period of time, or like a disc injury, a herniated disc. That would be considered a chronic issue. And
Mm,
that's where I focus. The name of my clinic is called the Chronic Condition Center. And because I kind of focus on those complex, long-standing problems that have been bugging people for a long period of time. And so when it comes to chronic problems, what leads to that is mostly it could be coming from degeneration. It could be coming from abnormal posture. It could be coming from poor ergonomics. A sports injury that never healed, like when you were playing football as a kid, and then when you're in your 50s, your knee bothers you. As the tree is bent, as the twig is bent, so grows the tree.
mm,
So, uh, a lot of times, or most of the time, what's going on is that, these people have an exacerbation of a pre-existing condition. They have something that happened years or even decades ago that's coming back to haunt them. And so, I have to do a very thorough, consultation and exam to find this sometimes hidden root cause of what's causing all this pain with people.
mm. Uh, and apart so say for instance, someone had a sports injury 20, 30 years ago, and they, let's say it was a knee, let's say, I don't know, let's say they had a grade 2 tear of their anterior cruciate ligament, but now it's 20, 30 years in the future. Why do you feel that someone might still be in pain? What would have caused that? Because, you know, you'd imagine that the ACL would have healed itself, but there's still pain in the knee. What do you think can be the cause of that?
What I found is that it's mostly related to degeneration or it's related to an imbalance of muscles. So, around the knee joint, you have 6 muscles on the front of the knee, 6 muscles on the back of the knee. And if the muscles are short or they're weak, that can cause an asymmetry, that can cause an imbalance in the way that the muscles pull. So, think of like a pulley. If you've got the pulley on one side and the pulley on the other side and a rope connecting the two, if one is more dominant, the other one's more recessive, that's going to cause an imbalance, and that often leads to degeneration, arthritis, some inflammatory process of other body tissues like bursitis or tendonitis or anything else than ends in itis.
Mm,
So, um, the first thing that I want to do is I want to get them out of pain. The second thing, I want to improve their movement and their motion of that joint. So, the quality of the movement and the quantity of the movement is very important. And then the next step after that is giving them little exercises that they can do and progressively ramping them up to more complicated and more intense exercises.
mm,
And we also focus on primitive body movements, things that were formulated or developed when you were a baby, such as rolling over or climbing a flight of stairs or walking. Sometimes people miss certain developmental phases, and that can lead to different problems.
mm. Yeah, you're speaking my language, Kevin, because this is kind of how I work. So, in the system I use, year two of the training, we cover what's called infant development, and we go through all the different stages from in utero through, each what we call each stage of development and how the baby develops. And it's quite interesting that how the baby develops is in exactly the same sequence that evolution occurred. So, for
And
instance,
I found that if they miss a stage of development, it can come back to bite them later on.
mm, absolutely, yeah, definitely. But I find it quite interesting how, when we're in utero, we are moving in water, right? Like the first animals that, well, not even animals, the first life forms were in water, and then after birth, we start crawling around like a worm, and then we start moving like an amphibian, then we start moving like a reptile, then we start moving like a four-legged mammal, and
Yeah.
then we use brachiation. We start pulling ourselves up like an ape, and then eventually we stand, and that's obviously how we ambulate as adults. But you're right, yeah. If we miss one of those stages, it can really cause a lot of issues later in life. And I actually had a tennis player come to see me, or at least the coach actually called me in to help with this female tennis player. She could hit really big ground strokes, but when she served, so when you serve, you go into like a partial squat, and then you literally jump, and then you serve the ball. Well, this female, I think she was 15 at the time. She did a normal ball toss, and she got into the knee bend position, but she couldn't come out of it.
Mm,
And he was saying, "I've tried every cue in the book." Like this guy, the coach, there's coached like some of the top female players in the world, and he's saying, I've run out of things. I don't know what else to give her. Do you think it's something physical?" And I said, "Well, let me analyze her properly, and then let's have a look." And I was actually analyzing one of the phases in infant development that's called the homologous phase,
mm,
and she couldn't do it.
mm.
And so the squat pattern is a homologous phase, and the squat is what you use to jump. And
Yeah.
she could bend her knees, but she couldn't get back out. And so anyway, I gave her an exercise to develop a homologous pattern. And I think it's just a few weeks later. Um, so the coach was also my coach at the time, so he was coaching her and me. And just so happens that she had a session right before me, and I turn up, and he said to me, "Look at her serve now." She was 15. She wasn't very tall, but she was absolutely smashing down her serve. And it was just because she missed, well, whether she missed that phase or it been knocked out some way in her older years. But just realigning that was incredible. If you've tried everything, stretching, physio, hands-on treatment, injections, and your pain still hasn't shifted, you're not alone. Most people try to fix pain from the outside when the real drivers are happening inside the body. Gut irritation, food sensitivities, nervous system overload, these often keep pain switched on. When you calm inflammation, the body can finally settle. The Pain-Free Plate gives you 7 foods that help support that shift. Download your free guide at bodycheck.co.uk. That's chek.co.uk/pain-free-plate. All right, back to the episode.
There's no one profession that has all the answers.
Mm,
Um, Chiropractic, we borrow from the current research and the current thoughts of people. I attended a seminar probably about 2014 from it was a program of care called SFMA. It was
hmm.
created by Gray Cook, the physical therapist,
Yeah.
and he's the one that like talked about primitive movement patterns and it was interesting because in the room there was about 100 people and physical therapists, chiropractors, mostly those two. And when he was talking about corrective exercises, the physical therapists were on it like crazy. They were like, "Yeah, right on. Let's give them some exercise." Right? All the chiropractors were standing around like, "What do I do? What do I do?" And but they talked about three areas where people develop chronic pain. One is faulty movement patterns. Number two is soft tissue lesions. And number three is joint problems. And when it came to the joint problems, the chiropractor was like, okay, what do you want me to do now? And the physical therapists were like deer in the headlights. Like, what do I
Scratching their
do?
head.
Yeah,
Yeah.
exactly. We all have strengths and weaknesses, and
Mm.
uh, I believe that just sharing information and for better outcomes for the patient. That's the ultimate goal.
Yeah, it's interesting you say that because do you know Dr. Mike Leahy?
I've heard of that name.
Yeah, he developed active release techniques. He was a chiropractor.
That's where I heard of him. Yeah, I
Yeah.
d- I do a version, a bastardized version of ART, active release technique, in my office,
So
and
so
for
so
people.
Dr. Leahy
Uh,
would call you a fart. Uh, is that's his joking term for a fake ART person, but
yeah,
it's just a bit of fun. But what the reason I brought him up is because he integrates the SFMA with ART now,
right, right.
which is quite interesting. Sorry, carry on. I interrupted.
No. I was going to say, I have studied ART. One of the things that I do a lot in my office is called trigenics, and that was developed by a Canadian guy who was also has dual citizenship in Estonia, and he he is a DO. He's a doctor of osteopathy, and he also is a chiropractor, and he talks about this theory about weak or short muscles, and he has a whole system of muscle testing, which comes from applied kinesiology, and so it's testing to see if the movement pattern is altered because of weak or short muscles, and then he tries to restore them back to normal, and a lot of times you can eliminate pain patterns by doing just that.
Mm. Do you know
It's
what
fast.
what the method's called?
Trigenics. Try
Trigenics. Okay,
me
interesting.
my, try mini three, and
Hmm.
then there's I forget the name of it anymore, but there's a certain type of a movement pattern, a certain type of a muscle that you target, and a certain type of a breathing pattern, and all of that has some fancy schmancy name to it. Um, it works incredibly well, especially for knees and for shoulders. Um, I've been able to help people that have had frozen shoulder for 20 years, and in one session, I can get rid of it.
Mm.
People are like their jaws drop when they get this.
Mm. I know a friend of mine does something that sounds similar, but it's not called Trigenics. It's called something else. But yeah, I can't remember what he calls what he does. But yeah, I think it's similar. But it's amazing. It's amazing that there are so many great modalities out there. And like you say, there's not one thing that will help with every condition, right? Or every person. My view has always been, you know, have as many tools in your toolbox, but also have as many people around you you can refer to as well. I think that's always really important. So,
I
whatever the
agree.
person needs, they can get it.
I agree 100%. I'm not loyal to any one technique or modality. I steal from the best of them.
Mm, yeah, yeah. Why not? Why not? As long as you can do them well, why not? You know.
Exactly.
Um. So you kind of mentioned earlier about the medical system, and if you go to see a medical doctor and you're in pain, particularly chronic pain, you mentioned the kind of modalities that they're treated with. And my personal, not personal experience, my professional experience from people coming to me is that they often feel gaslit by medical professionals. And they might say something like, "It's all in your head," or "Oh well, oh you've got depression. I'm going to give you antidepressants." It's like, no, I'm not depressed. I'm in pain. But they just don't feel like they've been listened to.
Well, I found that um, it's all in your head is code speak for I have no idea what's wrong with you. I'm going to give you these drugs. Get the hell out of my office.
Mm,
Right.
yes.
And in the United States, we live in a drug culture. And we, unlike England, we have drug ads all the time on the television
Mm,
and the radio and the newspaper. There's only two countries that I'm aware of that drug ads are allowed
mm,
to occur, the United States and New Zealand.
yeah.
And they both have the highest per capita costs of healthcare in the world. Go figure.
Mm,
Um, but what they want to do is to brainwash people to reach for the medicine cabinet for everything. So I'm not anti-drug. I'm not anti-doctor. I believe that there's a time and a place for all healing. But
mm,
I believe that we as a people in the United States are over medicated. And that's a serious problem that leads to opioid addictions and all kinds of things. The I always ask people to provide their drug list so I can see what's going on when I'm gathering information, when I'm doing my intake work. Most people that come to see me are on about 7 drugs, 7 different drugs. The most I've ever seen in my career, a guy walked in as his drug list was a page and a half, single space typed. And he walked in like a zombie because all the doctors had prescribed something for him and probably didn't need half of it. But
mm,
it's frustrating because we have laws that prohibit me from telling people to stop taking this drug. It's not doing you very good. It could potentially cause a lot of harm. So I have to kind of walk a tightrope when it comes to that. But I can educate them about their drugs.
mm,
I had a woman that was coming to see me, and she said, among other problems, she had constipation. And she was taking a smorgasbord of different pills. And I looked up the side effects of all these pills. One of them listed was constipation. And I told her that, and she didn't want to hear it. She, uh, don't get between me and my pills. Right.
mm. Yeah, you know what, Kevin? Just the other day, a family member of mine went to see their GP. Now, this family member of mine was on 0 medications, and they came back with 8
From one visit.
from one visit.
Wow. That's
And I
got to
don't
be some
even,
kind of record.
and they didn't even, I don't even think they felt unwell, or there was anything going on at the time. So let's just say I'll be having a conversation with that person in a couple of days' time.
It's 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 time to fire the GP and find another one.
Yeah. Well, unfortunately, over here you don't get a choice because obviously it's taxpayer-funded government
Uh,
system. So Yeah,
That's
you
got to
don't
be
get to
frustrating.
choose. You don't get to choose, not unless, well, I mean, you can go and pay an extortionate amount of money, but pain can feel hopeless when nothing seems to make a difference. But pain always has a cause. And when you find the cause, you can influence the outcome. I help people uncover the biomechanical, nutritional, emotional, and lifestyle factors keeping them stuck and guide them towards lasting relief. If you're ready to understand why you're in pain and what to do next, book a discovery call with me at bodycheck.co.uk/consultation. That's bodychek.co.uk/consultation. Now, let's get back into the show. So, whilst we're talking about the kind of current medical model, and apart from the way it's funded, it's not that different in the UK. Um, I would say a lot of people are starting to realise that what we call a national health service in the UK is just a money laundering service for certain big corporations,
Yeah.
which I would agree with. Um, but where do you
We had
think?
that with Obamacare
Yeah,
when Obama was our president. He made the pharmaceutical companies filthy rich by mandating that everybody go in that direction. And some people didn't want to do it, but either you buy this or you get a fine, one of the two. Yeah, it sounds like
that's
we've kind of walked down the same path.
yeah. I mean, that sounds like extortion, or that's the sort of thing a mafia would do, right? It's no different.
Well, well, when the mafia does it, it's extortion. When the government does it, that's for your own good.
Yeah, yeah. So, with regards to the kind of medical system for someone who's in pain, whether it's going to someone like a general practitioner, or you go to orthopedics, where do you feel that approach is falling short?
Well, I think that it depends on the person and it depends on the problem. Uh, from my perspective, chiropractic can help a lot more people than are currently using it. I would say that there's a couple of conditions that you definitely need to see a medical doctor for: cancer, an infection, or a broken bone. So those people that are have acute problems like that are best served by going to see a medical doctor. But if you have a chronic issue, there's something that's unresolved, even with all the different medications, let's try something different. You already tried the medications. Now let's go in a different direction. Because doing the same thing over and over again and then expecting a different outcome is one person's definition of insanity.
Mm,
And so I think that a lot of problems can be resolved by the very careful application and intelligent application of physical medicine modalities, whether it's chiropractic adjustments or exercises or stretches or um, just getting them back into condition, getting them eating better, getting them sleeping right, uh, getting them to manage their stress through a bunch of different types of techniques that I'll help them with. Um, that's really where the health comes from is mostly from practicing good habits. I
mm,
tell people good habits lead to good health, bad habits lead to bad health. So it's up to them what they want to do.
mm. And that's such a you know simple process, a simple way to look at it. And I often say the human body is very complex, but
Yeah.
oftentimes the solutions are very simple. You
Yeah.
know, drink
Yeah.
drink lots.
I agree with you. Like if going back to my chiropractic school days, learning physiology was really difficult, and learning about mitosis and meiosis and DNA replication and RNA stuff, it can be crazy complicated. But the goal is to make it as simple as possible for people so that they can follow along.
Mm, yeah. Yeah, absolutely. I mean, when I'm advising people, I always like to package it in a way that an 8-year-old would understand.
Yeah.
And
Yeah,
that's done
exactly.
respectfully. I'm not talking down to people, but I always think if I can't explain it well enough that an 8-year-old would understand it, then maybe I don't understand it well enough.
Well, the people that discovered DNA, explained it to the world, and it took them 5 minutes to explain the human genome. Um, you have to really understand the material to be able to simplify it and distill it down into little small chunk sized pieces so that the average person on the street can easily understand what's going on. And in my practice, it's about as much of a house of learning as it is a house of healing,
Mm,
because I want people to totally understand and own their problem. I don't want to just treat them and they just mindlessly slither away and do their own thing. That's the common approach that happens in my country. But I don't really think it's treating people in the fair way, not to deny them an explanation. Medical doctors don't even go over X-rays with people anymore.
mm,
You say you have a problem, sit down. Let's treat this. That's it. That's all they
mm.
do.
Yeah, it's interesting. And again, I don't want to make this whole episode about bashing medical doctors, but I often find people come to me and they've got reports of scans, and there's all these very long Latin words. And yes, I can understand them. So clients bring them to me so I can interpret into English, right? What this means. And I was having a discussion with a friend of mine who's a former consultant foot and ankle surgeon, and and I said the same thing to him. I said, my clients can't understand the words that are written on the report. He said, I've got news for you. I said, what's that? He said, neither do the doctors. He said
Well,
they use long words because they don't even know themselves.
I don't I don't I don't consider this medical bashing as much as is a discussion about the philosophy behind what they do and what I do. Um, a picture is worth 1,000 words. So, oftentimes I'll tell them, please bring in your X-rays or your MRIs and let's see what normal looks like, and then let's see what you look like, and let's compare the two back and forth. And a metaphor is worth 1,000 pictures. So sometimes I can hold up a bowling ball and say, "This is your head." If I hold it out in front of my body, how long do you think I'm going to be able to hold it up?
Mm,
And they understand concrete analogies of a kind of a complicated topic like forward head posture and
mm,
what it does to the muscles, what it does to the ligaments and the bones and the neck, and complicate that by 20 years. And the light bulb goes off over their head.
yeah,
A lot of what I do has to do with communicating complicated ideas and distilling it down into little small bite-sized pieces so that the average guy in the street can understand. Whether I'm talking about a joint problem, or I'm talking about a muscle pull, or a grade 2 ligamentous sprain strain, or whatever, it all there's an analogy that can go behind most of that stuff that they can understand.
yeah, yeah, absolutely. Again, you're absolutely singing my language. Um, so if someone comes in to see you with a chronic pain condition, I think it would be natural to assume they would probably get some kind of chiropractic care. You might give them some exercises to do. Where would the kind of clinical nutrition aspect come in? Would you do some of that with some of your patients or all of them, or how do you work in that way?
Well, I would say that for the person that comes to see me, not from they didn't come to see me for nutrition. I would get them involved with like a multivitamin, maybe a fish oil, maybe a probiotic, just wellness-based supplements. But if they come to me with a specific problem and they want me to fix this problem, whether it's hypothyroidism or like Hashimoto's disease, or they have a gut problem, um, I will prescribe certain supplements to complement a healthy eating program. I spend a lot of time with people and teaching them about pro-inflammatory foods that can manifest as joint pain.
Mm,
So, for example, if a person eats a lot of sugar, if they consume a lot of dairy, if they eat a lot of grains, sometimes those things can cause inflammation. And by getting rid of that out of your diet or focusing on lean meats, fruits, and vegetables instead, we can make them to feel better. The brain works better. Their heart gets better. The blood pressure restores back to normal levels without drugs. I mean,
mm,
it's truly amazing at how many different problems, how many chronic issues can be resolved just by incorporating healthy lifestyle choices. And a lot of people hear that and they gloss over it. They don't think it applies to them, but it all boils down to habits,
mm,
down to eating habits, exercise habits. Um, there's a it depends on what the problem is. So if it's say a joint problem, chiropractic would be a great modality to help with the joints, to help with the posture, and that kind of stuff. If it's a if it's a brain-based problem, let's say they had a stroke, then chiropractic would be kind of limited in its scope. And so I would uh I would do other types of stuff for that.
mm. Yeah. Now, the reason I asked that question, for me, nutrition plays such a fundamental role in everyone that I work with, and including people that are in pain. If someone, let's say they've got lumbar disc issues, let's say as an example, and they're eating foods that are causing inflammation in the gut, well, what tends to happen is what's known as a viscerosomatic reflex, and the type 1 muscle fibers in that region, particularly muscles like the transversus abdominis and the multifidus, become inhibited. So now that area has become unstable.
Yeah.
So addressing something like that can be really important. Or, as you mentioned as well, joint issues. I see a lot of people with joint issues. Quite often they've got leaky gut syndrome. So things are leaking out into the bloodstream, get into the joints and causing irritation in the joints. And for me, it just plays such a crucial role, nutrition. And um, I do know people, and they say when I'm on it, when I'm talking about people I know personally, they'll say, yeah, when I'm really nailing my nutrition, my pain's either gone or very little. But if I go off
Yeah.
track, now all of a sudden all the pain comes back with a vengeance. Um, and I
Well,
see, I see. Sorry, go
I
ahead.
I I I wanted to make a comment real quick about in the nervous system, about 10% of your nervous system, it conducts pain signals. The A fibers and C fibers. 90% of the function of the nervous system has nothing to do with pain. And so you can categorize it as vestibular or balance control, nothing to do with pain. Motor function, such as when you want to eat, you need to bring your hand up to your mouth. Those motor signals have nothing to do with pain. And the sensory function, there's hot versus cold, sharp versus dull, cold heat, cool vibration, light touch, tickle, the special senses such as vision, smell, taste, touch, proprioception, which is where you know where your body is in space. All that stuff has to be factored in, and all of it is going to be regulated primarily. Well, uh, there's a lot of things that regulate it, but nutrition comes into play for all that stuff. So
Mm,
for people that are really trying to get their their body in harmony and get as healthy as they can. It all starts with the fundamentals: proper nutrition, proper sleep, uh, care of your exercise, um, corrective care of the posture and the joints and that stuff. All of that has to play a factor. And
Mm,
so I'm looking at the big picture more so than just getting them out of pain and kicking them out the door. I want them to get the best possible results they can. And a lot of times that comes from changing what they want to eat and changing how they move.
yeah. Yeah, absolutely. Again, I completely agree. What I would add to that is hydration. That would be another key
Yeah.
factor. Breathing, how they breathe as well. So again, we know
Yeah.
when someone's in a stress state, for instance, that increases pain perception. Um, and also the mind. Again, if someone's stressed, just as one example, again, they're more likely to feel pain than someone who's feeling relaxed. There's
Yeah.
quite a lot of research into that.
You're
Okay.
you're exactly correct. I agree completely with you. Um, and in certain cultures in the world, they place a lot more emphasis on breathing. Like I'm thinking of the Chinese. They have different systems of meditation and focused breathing and exercises, and that helps them to modulate their stress response as well. Um, I probably need to do more of that in my own practice.
Mm.
Excuse me, once.
A pattern I constantly see in my clinic is that people blame their pain on the final movement they made, lifting something, twisting, slipping awkwardly. But the truth is, the body was already inflamed and stressed long before that moment. When you reduce inflammatory load from food, everything settles, joints move better, muscles relax, and pain becomes more cooperative. The pain free plate shows you 7 foods that support that process. You can grab your copy at bodycheck.co.uk. That's bodychek.co.uk pain-free-plate. Now, back to the show. Yeah, even things like meditation, hypnosis, things like that can really massively help with pain. I mean, people today have surgeries without anesthetic because they're using hypnosis. They hypnotize themselves so they don't feel pain. I
Yeah.
know that's being used a lot with men having vasectomies, for instance.
Yeah.
I mean, I don't know about you, but I wouldn't fancy someone going anywhere near there with a scalpel, but let alone without a
No,
anesthetic.
I, I, I was just about to say if you want to approach that area with a knife, knock me out.
Yeah, we're definitely on the same page on a lot of different things. So, what do you think would be the best advice? So, someone that they're watching this, listening to this, they're in pain, they've been to see many people, they haven't really helped. Possibly, the treatments made them feel worse. What would be some of the key things that you would want them to know or to be aware of?
Well, I want to first and foremost tell them that we it's if they've already tried the drugs, if they've already been to the medical doctor, it's time to try something different. And after that, then I would go as specific as I can about the root causes that is driving their problem, whether it's like a joint problem or a herniated disc, or it's a muscle pull from playing sports or something. I want to find out exactly what is causing this to happen by finding out what were they doing at the time that they started to experience pain. What were the circumstances behind it? Uh, and then do a thorough evaluation. Check their joints, check their muscles, check their ligaments, see what they can do and what they can't do. And then after that, then I would be able to prescribe a customized treatment plan that is tailor specific for their particular needs. There's no one size fits all.
Mm,
So everybody's a little bit different. Some person may need something like shockwave therapy. Another person may need laser therapy or spinal decompression or ART, or
Mm.
as I practice it, FART. So it depends on what the needs are. So
Mm,
I'm there to, I don't really consider myself healing them. I consider myself a facilitator,
mm,
and then their body heals itself.
yeah. You know where the term doctor originally comes from, right?
Latin for teacher?
Exactly.
Yeah.
Yeah, and that's what we need, isn't it? We need more doctors doing more teaching and less treating, I would say.
Well, I think a lot of people mistake the word doctor for he who prescribes drugs.
Mm.
Um, that's just a
That's
glor
what it's become, sadly.
that's just a glorified drug dealer,
Mm,
right? Um, I think that medical doctors, the best medical doctors are the ones that use the least amount of medicines on their patient, not the most. They shouldn't have a vested interest in getting them on the most drugs possible. Um, like I said, I'm not anti-doctor. I love and respect doctors. Some of my best friends are physicians, and we have polite discussions about the differences between chiropractic and versus medicine. And I, I just I wonder if they feel that maybe they went down the wrong path somewhere
mm, mm,
with the basic philosophy about what they do. There's a time and a place for all healing, and I just think that unless it's a surgical case, uh, they probably should be somewhere else. I've only had to send one person in my 25 years to the hospital. There was a woman that was in my parking lot screaming in pain, and she had a sequestered nucleus pulposus that was broken off. It was calcified, and it was poking on her spinal cord.
wow.
That is a surgical case.
Mm,
Do not pass go. Do not collect $200. Go directly to the emergency department. Um, Everybody else has been fine.
mm. You know, we've got so many similarities. I've only ever had one client that I sent to hospital, and she was actually having a panic attack. It wasn't even because of pain. Um, yeah, she had a lot going on in her life right then. But
Right.
yeah, interesting. Do you do you ever see patients with fibromyalgia?
I see patients with chronic pain. The fibromyalgia is a very complicated topic, and I found that a lot of people that have that problem, most of the time, they have really poor eating habits. They consume a lot of sugar. They consume a lot of junk food. They don't do anything to detoxify their body on a regular basis. I'm sure there are some people out there that are the exceptions to the rule. However, my experience has been quite the opposite. I found that I can the way that I would approach that is by with functional medicine and by lab testing and changing what they're eating and focusing on more of a wellness lifestyle approach.
Mm,
That really knocks out about 92% of all cases that I see.
mm. Yeah, I know. There's a well in these circles, he was quite a well-known osteopath here in the UK called Leon Chato. He's not with us anymore. But
Yeah, yeah.
he was very big into um, breathing pattern disorders and how that can eventually lead to things like fibromyalgia. And I know I've spoken to lots of other people who generally say there's always an emotional component to fibromyalgia as well, which if there's an emotional component, it's going to affect your breathing pattern, which is
Yeah.
quite interesting. But yeah, I also think there's probably like gut health issues going on as well with almost all fibromyalgia cases. So one question I often ask people on this show, because there's a lot of people in the pain science field suggests that there's no link between posture and pain. And also, they go further and say anyone that does any kind of postural assessments are charlatans, and they're really they're doing it to take money off people. They're not really nice people.
All right.
What would be your response to that? There's no link between posture and pain.
I think that there's absolutely a link between posture and chronic pain, posture and organ dysfunction. People that have, say, a scoliosis, that have abnormal frontal view curve of the spine, that can interfere with breathing and cardiac output. It's already been established in the
Mm,
scientific literature. Um, and in the chiropractic profession, there is a couple of people that have done a lot of research into this, such as Don Harrison, Steve Troyanovich, Burl Panabon. These people have reviewed hundreds of thousands of x-rays. And what they found is that people that have, say, an abnormal curve in their neck, an abnormal lateral curve in their neck, have accelerated degeneration of the disc material, accelerated degeneration of the bones, leading to bone spurs. It tethers the spinal cord, meaning it stretches it. It causes headaches and migraines, all kinds of things. And one of the things that they advocate is traction correction to do the structural correction. We previously talked about uh, development as children. And when the baby is born, they have a C-shaped curve to the spine.
mm,
That's a fetal position because you're in a aqueous environment for the first 9 or 10 months of your life. And then when the baby is a little bit older and they start to push up and look around to see what's going on, they develop that curve in their neck. And then when the baby starts to walk or starts to crawl, actually, the weight of the abdomen starts to pull down on the lumbar spine of the low back and starts to develop a curve in that area. So when the child is fully developed, and as an adult, when your bones are fully ossified, your spine has a shape that looks like an S. The neck bends forward, the mid back where your shoulder blades are bends backwards, your low back curves forwards, and your tailbone curves backwards. And I found that people that have lose that curve, or either because they fall out of a tree or a car accident like a whiplash injury, or they jump into a swimming pool and hit their head on the bottom, their neck buckles, it straightens out or it bends the wrong way, and that causes all kinds of chronic pain issues that cannot be resolved by a simple chiropractic adjustment. It's resolved through a long, slow process of traction. Doing traction involves uh, deforming the ligaments that hold that curve in place. It's called the anterior longitudinal ligament, and that behaves very much like silly putty. If you ever play with silly putty as a child, you pull it really fast, what's going to happen? It's going to break, right?
mm,
If you pull it really slowly, it's going to stretch. So that's really what the key is for correcting that problem. We use mirror image exercises, mirror image adjustments. So if they have a forward head posture, we want to bend it the opposite way and stimulate the proprioceptor, the mechanoreceptors in the spine to hold that posture in place. If they have a high shoulder, we want to bring that down. If they have a rotation or a translation in the pelvis, the thoracic spine, or the cervical spine, that can absolutely cause pain because it can cause fatigue and stress on the soft tissues of the spine, and it can cause degeneration of the bones, and it can cause accelerated wear and tear of the disc material. If you
mm,
ever talk to a radiologist, they will completely agree with this, but
mm,
their voices are very loud.
mm. Yeah, I mean, again, there are studies out there that show, the way that the spine is designed, it takes a certain amount of load through the vertebral bodies and the disc, and it takes a certain amount of load through each of the facet joints that sit behind the vertebral bodies. So if you've now got an altered posture, so again, my experience, everyone who's come to me with a lumbar disc bulge has had a reduced lumbar curve.
Mm,
Everyone that's come to me with facet joint irritation or spondylolysis has had an excessive lumbar lordosis every single time.
yeah.
So to say that posture and pain aren't linked in any way, I think is just not quite accurate. I do understand, again, there's a really famous study by Booz et al. That says, they did scans on, I can't remember how many people in the study, but 76% of them that didn't have any lower back pain had derangement of their lumbar discs. So it doesn't guarantee pain, right? But 96% of them who were in pain also had damaged lumbar discs.
So pain is one marker, but it's not the only thing that needs to be paid attention to. Remember, 90% of the nervous system has nothing to do with pain signals. It has to do with function. And um, Don Harrison, he was a chiropractor. He was also a PhD and engineering. And so he postulated that there is a normal upright static posture for the spine. He published peer-reviewed studies in Index Medicus journals and all over the world, probably over 100 studies proving these his theorems. And for some people, it's not everybody. I like I told you before, I think that there's different people have different problems, but that's one of the things that I look at is what's going on with their forward head posture, what's going on with rounded shoulders, what's going on if they have a high hip or a rotation somewhere. That is going to be problematic, and that's a problem to be solved.
Mm. Yeah, there was a guy called Serge Grakovetsky. I don't know if you know the name, but he was a mathematician and he produced a book called The Spinal Engine. But he actually used mathematics to explain, particularly how the spine dissipates load through the body, which was quite interesting. So there is a lot of evidence to show that there is a link between posture and pain. It's just not a 100%. If there's poor posture, there is pain. It's the human body is a lot more complex than that. There's so many other factors that are involved in pain. We've mentioned diet, breathing patterns, stress levels, could be emotions, sleep. All those things can all tie in. It's not just about posture, but it does play a big role. I think that's probably
That,
a fair thing to say.
that's a very accurate statement.
Yeah. So just to wrap up, what would be your kind of parting message for anyone who's suffering from chronic pain?
I would say that the what would best serve people is to keep keep it simple. Focus on the fundamentals. Focus on things like um, are you are you consuming good nutrition first and foremost? Are you exercising? Are you taking care of your body? Are you managing your stress? Are you managing your posture, your joints? Um, Breathing, hydration, all the things that we talked about during our discussion are very, very important to do to to have a conscientious effort placed on these types of things. They're very often overlooked, but they're very, very important.
Mm,
And I would also say that anytime you have a problem, whatever it is, whether it's your back or your teeth or your lawnmower or your house, you always want to start off with the most gentle, non-invasive thing you can first. If it's a body white thing, the easiest thing to do would be to get a massage or change your diet or focus on wellness and fundamental type things. Then go into something a little bit more invasive like medicine. or something at the doctor's office. If that doesn't fix the problem, then go and consult with a surgeon. But people make assumptions. In my country, they want to start off with the drugs first, and then the surgery, and then after that, when that doesn't fix them, then they go to a chiropractor. That's exactly the wrong approach. And
Mm.
so the correct approach is to start off with the basics, the non-invasive stuff first, and then try something a little bit more invasive, then a little bit more invasive until you reach your satisfaction. If you can knock this problem out with basic things, you don't need it. You don't need to go any further.
Mm.
But prioritizing what you want to do first is very, very important for people.
Yeah. Yeah, I completely agree. And just to kind of add to that, yeah, definitely the first thing, maybe go for that low hanging fruit. But even before that, what I would suggest to people, even before you decide what you're going to do first, I think it's really important from a behavioral perspective is to get really clear on how your life is going to be better when you've solved that problem. What are you going to be able to do when you don't have any pain? Is it going to be you're going to be able to play with your kids? You're going to be able to look after your grandkids? Does it mean you can go back to work and actually earn some money? Or does it mean you can work better and earn more money? You know, I think that's the most
Yeah.
important thing because, you and I can give people the best plan to follow, but if they don't do it, it's not going to work. So getting really
Yeah.
clear on what your motivation is. And then because, we live in the real world, we have ups and downs. It's very easy to fall off the wagon when you're having a bad day or when you're particularly having a stressful time. But if you can keep focused on the end goal, which might be playing, getting back to playing sport or, playing with your kids, whatever it might be, doing your gardening, whatever brings you joy. If you keep focusing on that, the decisions become much easier to make.
Yeah, you're right. I agree completely.
Awesome. Kevin, this has been great, but what's next for you? What do you have in the pipeline?
Well, I want to just continue to help as many people as divinely possible to get on the right path and to get better. Um, I would say if you have a problem, and for people that need to get better, the best way to reach me is to visit my website at metabolic correction.net. And from there, you can read about me and about what I do, and we can hop on a Zoom call if you have any specific questions that you need me to help you to resolve. Let's do that.
Awesome. Yeah, it was funny. Just as you said that if you've got a problem, what flew into my head was you can always call the A team. You remember the A team from
There
was
you
it
go.
back in the 80s? I don't
There's
know
a
why
plan
that
and
just
everything. Plan comes together.
that's it. That's it. I don't know why that just flew into my head. I suppose I've got a crazy mind like that. But Kevin, thank you so much. I really enjoyed this conversation. It's I suppose in a way it's good to see that, you know, we're on different sides of the world, but we've got very, very similar ideas as to how to help people in pain.
It was a pleasure and an honor to be here, and I thank you very much for having me today.
Thank you. Thank you for your time. And that's it from
Thank you.
Kevin and me for this week. But be sure to tune in, same time, same place, next week on Beyond the Pain. Thanks for listening to Beyond the Pain. If this episode resonated, please follow the show, leave a review, or share it with someone you know who's been struggling. And remember, pain is not permanent. With the right insight and support, you can turn it into power. Until next time, stay open, stay strong, and keep moving beyond the pain.